Hello, good morning or good evening or good afternoon from the World Health Organization. My name is Alexandra Kuzmanovic, and it's Wednesday. It's the time when we answer your questions about COVID-19 pandemic. As June is parenting month, today we are focusing on answering your questions about COVID-19 and children and parenting tips. So please feel free to ask your questions if you're watching us on Twitter by using the hashtag AskWHO. If you're watching us on Facebook, LinkedIn, or YouTube, please leave your questions via comment section. I am pleased to be joined today by three guests, not only two. The first one is our Dr. Maria Van Kerkhove, who you know very well. My second guest today is Anshu Banerjee, who is our Director for Maternal, Newborn, Child, Adolescent Health and Aging. And our third guest is a special guest today, who is our colleague from UNICEF, Jérôme Pfaffmann, who is Senior Advisor for Health Emergencies in UNICEF. Good afternoon, and Jérôme and Anshu, thank you so much for being with us in this special session today. And of course, thank you, Maria.
Thanks, Alex. We're happy to be here.
Thank you. While we are waiting for questions from our viewers, Maria, maybe you can give us some epidemiological picture of how children have been affected by the COVID-19 virus. And yes, just give us some epidemiological picture to start with.
Okay, thanks, Alex. Thanks for having us, and I'm really happy to share this space today with Anshu and with Jérôme, our colleague from UNICEF, who's been working directly with us since the beginning of this pandemic. I think just off the start, really want to highlight the special relationship we have with UNICEF, with so many different partners, and it's really we're really grateful to work with Jérôme and many wonderful people from UNICEF. So with regards to children and COVID-19, I mean, children have been impacted by this pandemic in many, many different ways. But keeping my answer to the epidemiology, what we know about children is evolving, and it's always, we're learning something every day. Even though many of us feel like we've been in this pandemic for a really long time, it's still a new virus, and we're still learning every day. With regards to children, from the beginning, we've known that children can be infected with the SARS-CoV-2 virus, the virus that causes COVID-19. But children tend to have more mild disease, and many children who are infected with SARS-CoV-2 have asymptomatic infection, meaning they don't have disease at all. This is not universal. We do know that some children have developed severe disease, and some children have died following infection and the development of disease. Fortunately, that seems to be relatively rare, but it does happen. And we know that children with underlying conditions are at a higher risk of infection, at a higher risk of developing severe disease. We do know epidemiologically that it's difficult to detect the virus in children if surveillance is not taking place in children. For example, if children aren't being tested, it's hard to really understand the extent of infection. So we do measure this through serology, where we collect blood and we look for antibodies. And we do know from serologic studies that children have been infected, but again, to a lesser extent than older children, adolescents, and older people. We do know that with the emergence of these virus variants, you've heard me talk a lot about, variants are just versions of SARS-CoV-2, and there are 4 variants of concern that are circulating the globe. We know that these virus variants have increased transmissibility, but we do see increased transmissibility among all age groups. And that's really driven by social mixing patterns. So if younger people are out, if they are mixing, and if variants are circulating, then that is the age group that will be infected. We have not seen virus variants target children or specifically target younger age groups. It's really driven by the social mixing patterns. So generally, this is what we see. Children can be infected. Children can spread the virus to others. They can be infected by their parents. They can infect their parents. But luckily, so far, we do still see children tending to have more mild disease.
Thank you, Maria. And maybe as well as we are talking about epidemiological situation and how children are affected, maybe you can walk through our viewers as well through symptoms of COVID-19 in children, how parents can recognize if potentially their kids are infected, and is there any difference between symptoms in children and adults?
So that's a really great question. It's very difficult to distinguish SARS-CoV-2 infection from other respiratory pathogens that circulate. And so common symptoms, include the respiratory illness, the coughing, the sneezing, not so much. But some have fever, maybe not developed fever on day one, but may a few days in. We have seen some children present with gastrointestinal illness. So, stomach ache, diarrhea, vomiting. But the signs and symptoms that we see in children, we also see in adults, but to a lesser extent. It's not as severe. In terms of differences, in some studies, there's been a suggestion that there may be more gastrointestinal symptoms compared to adults. But really, it's not that different. What is very difficult is to distinguish between SARS-CoV-2 infection, other respiratory infections like RSV that may be circulating, influenza that may be circulating. However, in the last year, we've really seen flu circulation reduce drastically, and RSV tends to be in the much younger age groups. I have 2 kids, and I have one little one, a 2-year-old who's been sick over the last couple of months. It's not COVID, it's not flu, but we don't actually know what respiratory illness he's had. But lots of kids have lots of respiratory infections, and it's very difficult to determine. So we determine this through testing. But the care that we give to children, again, is based on symptoms. It's based on the severity of their disease. Any parent that is concerned about a child who is sick, contact your pediatrician, contact the hotlines that are set up in the country, and ask, because it depends on the child. It depends on the underlying conditions that they may have, lots of different factors. So always reach out to your medical provider if you can, to ask questions and for more specifics about your specific child.
Thank you so much, Maria. I'd like to also ask Anshu and Jérôme on what are the broader impacts of the COVID-19 pandemic on children's health and development. Anshu, maybe you would like to start.
Sure, thanks, Alexandra. And so one issue, of course, has been the closure of schools. And because of school closures, we've seen that children had to stay at home. They had less space to move around, and that has caused mental health problems. But we've also seen that a number of children actually got services, health services in schools, for example, for anti-conception. And so they haven't had access to that, and that has led in a number of situations also to increase in pregnancies in teenagers. At the same time, of course, a number of children have been depending on schools for a school health meal, for a healthy school meal rather, and they haven't had access to that. So we've seen that in a number of countries also, the nutritional status of children and adolescents has reduced. And of course, it has also had an impact on their educational development. And on their mental health development and development of social skills because of less interaction with their peers, less interaction with other age groups. And so the school environment has shown actually that it's very important, a very important environment for children for their overall development and not only for their educational outcomes. So this has been one. The other impact on children has been particularly also, I think, as Maria was highlighting, the interaction with family members. And I must highlight that children have also lost grandparents, etc., and they have not had the opportunity to actually engage. And so this emotional stress, emotional trauma has also played a role on children that have lost parents or have lost grandparents, and how to deal with that is also an issue that needs to be supported, and that's really looking at the mental health of the child. So I think the COVID pandemic has really shown us that many of the services that we provide for children are integrated and are not, let's say, singular on their own. So schools do not only provide education, they provide many other things. And so that's a very important lesson that we've learned.
Thank you so much, Anshu. Jérôme, do you have any thoughts on this as well?
Yeah, if you may, I will just complement. I fully agree with what Anshu said. I also fully agree about what Maria introduced on the epidemiology and the symptoms that the case management of children. I will add a few things. The first one is a complement on what Maria said. It's true that we see a small proportion of the total cases that are that are affecting children and that require intensive care. But I just want to say that regardless the number, even if it's 1, 2, 3, 10 children, they still deserve the best care possible. And I want to acknowledge that WHO and UNICEF and other partners have worked together to make sure that specific consideration for case management of children, which includes some medical and pediatric consideration, as well as mental health and psychosocial supports, are part of the guidance and support we provide to government and to practitioners so children can receive the best care possible. So that's one thing I wanted to say. The second thing I wanted to say is also when there is mild cases and the children needs to be taken care of at home, there are some guidance that were developed and support that is provided so we can provide actually adequate care for children during this moment where they need to be isolated and supported. And it's very important to ensure that we do this with solidarity and considering the best interest of children all the time. And as Maria was saying, children are sick and they're going to continue to be sick of COVID-19 or many other diseases, including malaria, including pneumonia, including diarrhea, including severe acute malnutrition and other diseases that we are seeing among children. And it's very important to continue to seek care during a pandemic. And I would like to encourage this message and encourage to go and see your pediatrician. And when there is no pediatrician and doctors, community health workers and community peer supports have been trained, community volunteers have been trained. We work with the Red Cross as well to make sure that this care can be provided to children and appropriate support given to parents when they care for their children. On the broader impact, the closing of school is always a terrible decision. I mean, this is always the worst thing that can happen to children and to the entire society. So I'm not saying we should not close school anytime. Of course, there are some moments when no alternative can be made, and it's usually mainly the results of a widespread community transmission. But it's very important that this is considered as a measure of last resort, and that school are the last thing we close, and there's also the first thing we reopen when we can start to reopen and reduce public health and social measures. And it's very important to take the time when schools are closed, if schools need to be closed, to invest in the education system so we can reopen them. I'm going to pause here at this stage. Thank you.
Thank you so much to both of you. And here is the follow-up question. Do we know if there were any specific impacts of the pandemic on adolescent girls?
Who do you want to start? We could probably all answer that question. I think we could all say yes. Maybe Anshu, I don't know if you want to start with that one, but absolutely yes. Anshu, maybe.
Yes, maybe just to highlight, I made the reference to access for services for sexual reproductive health in schools. And that, of course, has been one of the major issues, that girls didn't have access to that and boys neither. And so that had an impact on or can have an impact on teenage pregnancies. But the other issue also has been that because schools closed, there have been a number of parents who have taken their girls out of school, and that resulted also in an increased number of early marriages for girls. And so this, of course, is something that we don't want. We want girls to be able to continue to finish their education and not be pushed into early marriage, and therefore also become very young mothers. It's also not very good for their newborn babies because they're not the girls are still not fully developed themselves. And so this is indeed one of the concerns that we have had because of closure of schools and because of lockdowns, whereby in a number of countries, parents felt uncomfortable to keep their girls just at home and resorted to, let's say, early marriage.
Thank you so much, Anshu. Jérôme, would you like to add, or Maria?
I'm going to add, or Maria.
Please go ahead. Please go ahead.
I'm starting. So just to say that, unfortunately, and this is a terrible situation that is not due to COVID-19. We've seen that public health emergencies and emergencies overall are associated with increased gender-based violence. And I think this is something we need to take very seriously as public health practitioners. And we need to look into what are the tools, the solutions that we provide as part of the package of public health and social measures that we recommend and implement, so we can actually mitigate the consequences of emergency response on girls and women overall. I want to highlight and advise to the audience that this is it's terrible, and we absolutely need to encourage adolescent girls and women and girls to seek support as well. And it's very important to talk about it when you are a victim of violence, and to seek support and leverage the social network that is made available. And for parents, it should be a subject to talk about. It's not a taboo, and you need to be able to make this a possibility with your kids, so they can express some fears, they can express some concerns, or share with you some situation. Also provide an extended peer support, extended network, so they can share with other than you as parents, so they and seek for additional support if needed. Thank you.
Thank you, Jérôme. Maria, please, do you have something to add?
Yeah, maybe very briefly, because a lot of this has been covered, but maybe just to emphasize that in many parts of the world, WHO and UNICEF, we're global organizations. We work with people around the world, everyone, everywhere, in every type of situation. And in many parts of the world, this pandemic has really been a disruption. It's been very challenging on many aspects. But for young people, particularly girls, but not only girls, it's been life-changing. And so when there is a disruption to your education, and when there is a disruption to your life, and you're taken out of that, as Anshu has said, it's resulted in many young girls being married and having children of their own. And it's life-changing in that sense. And many girls do not go back to school, even when those schools open. And so for them, that life course that's changed really needs to be addressed. I also fully support seeking support, but in addition, we have to provide that support. We need the services in countries to be able to provide the support that's tailored to the needs of young girls, and young women, and tailoring to what is actually needed. And so just to not provide those services is really a disservice to those young people. So it's not just about the physical health, because some people are sent home, are in home in violent situations, but it also impacts their mental health and their future. So there's a lot to work through here. But we as an organization work with partners to go beyond just making recommendations, go beyond providing the advice, but actually provide the services to be able to support countries to help those in most need. Thanks, Alex.
Thank you, Maria. And speaking not only about adolescent girls, but also we've seen some reports on domestic violence against children. So Anshu, maybe you can tell us more about that, and how can these children get support if we have lockdown measures and they are not going to school, or they are not seeing someone else except that violent environment, how they can get help, and what is WHO doing to support countries to identify those cases?
Thanks, Alexandra. And of course, we have noticed during the pandemic that not only violence against women and gender-based violence has increased, but also violence against children. And this has been because their social space has been reduced. And particularly in households where there was already violence, and then, limiting the space and limiting opportunities for children to go out has increased violence against children. So what can be done is, first of all, indeed, as Jerome also mentioned, talk about it, make sure that the parent who is maybe not violent, or another family member who is not violent, to have a conversation with them, is indeed to make use of their social networks, and potentially make use of a hotline, call, ask for help. And as they are children, they most likely have to navigate this through one of the other family members. But it's very important that they are aware of this, that they know that this is not acceptable, and that they can discuss it with someone else within the household. So what we need to be able to do is make sure that we provide support to other older children in the household, and older family members, that they know where to go, where to seek services, and be able to get that support.
Thank you so much, Anshu. We've been receiving some questions and been seeing some reports in the news about how social development of children have been impacted by lockdown measures, including on their language and speaking skills in earlier child development. So do we have any studies about that, and maybe some advice? WHO or UNICEF. So Jerome or Anshu or Maria, whoever would like to start.
Sure. So when we developed the guidelines for mask wearing, of course, we were aware of the fact that it might be difficult for smaller children and for children, let's say, between 6 and 12. But we really had to look at the circumstances during which it would be advisable for them to wear masks. For children above 12, that similar to adults, in similar situations, they should wear masks. But one of the issues that has been highlighted is indeed that because they wear masks, it's difficult for the teacher to see their expressions, and at the same time, if the teacher wears the mask as well, for the children to see the expressions from the teacher. And particularly, for example, for children who have some loss of hearing, it might be difficult to understand what the teacher is saying. And so for them, in those situations, it would be advisable, for example, if the teacher is wearing a face shield rather than a mask, or a transparent mask, so that they can also lip read and understand better what is happening. We also know that wearing masks can be stressful for children, to wear the mask the full day in the classroom, etc., and therefore cause stress to them. And so it's very important to discuss this with them. But overall, of course, we know that it's a good public health measure to reduce the spread of coronavirus. The evidence is out whether it has really caused a delay in development and learning. And we do know that, for example, in Germany, there is a registry where people can provide information about mask wearing, and hopefully, we'll be in due time be able to identify with evidence whether there has been an impact or not.
Thank you so much, Anshu. Jerome or Maria, would you like to comment?
I'm going to start. I think you covered most of the mask questions. What I want to emphasize here is that beyond mask, what is key is to consider the best interest of children when decisions are being made. And this is true for all the public health and social measures. And this is true when it's also done at individual and community level. In your question, you make reference to lockdown. And I think actually lockdown is a very large and undefined terminology. And what we need to look at is not lockdown as a blank decision. We need to look at each of and every public health and social measures that exist, look at when they need to be implemented, in which context. The context matter a lot. The individual and the impact on the individuals and on children matters a lot. And that's, I think, the risk benefit needs to be key in any decision that we make. One of the key recommendations that we made in our guidance is that decision for public health and social measures needs to be made at the most decentralized level and on risk-benefit analysis. So I just wanted to emphasize on this because it's a key element. It's not one way or the other. It has to be balanced based on risk-benefit, looking at the best interest of children.
Thank you so much, Jérôme. And Maria, here is a follow-up question. Maybe you can take this one from Jayakumar Padamanba Pillai, watching us on Facebook. Should we apply more safety measures to control and stop the spread of COVID-19 and its variants among children?
Well, I mean, thank you, Jaya, for the question and for watching. I mean, I think that it's a good question for everything related to this pandemic. The variants complicate matters. Given that variants have increased transmissibility, this has to do with the different mutations that are identified in the variants. And for example, some of the mutations allow the virus to adhere to the cell more easily and therefore can infect the cell more easily. The modes of transmission are the same. This virus primarily spreads amongst people who are in close contact with each other through these infectious aerosols and droplets. And those are just different sized particles that have virus in them. And it's mainly happening in close contact, but could also happen at further distances depending on the type of situation, particularly in closed settings where you have poor ventilation. And the measures that we put out are about preventing the spread. First of all, preventing infection so that you don't get infected. And this is the same for children. So the measures that we have in place for people is for all ages. And it depends on the context. It depends on the living situation. We have to also remember that around the world, the housing situation is quite different. And in some countries, the average number of people per household is 1 or 2. And in other parts of the world, it's upwards of 10, 11, 12, even higher. And so some have multi-generational homes where you have very young children with grandparents in the same household. And so the factors that are put in place, the physical distancing, the hand hygiene, the mask wearing, the good ventilation, all of that is the same, but how it is implemented is quite different around the world. And when we talk about the adjustment of measures, as Jérôme pointed out, there's a number of factors that need to be taken into consideration when these are adjusted. A lot of it is dependent on how much virus is circulating around. In many parts of the world, COVID has been controlled, and so measures can be lifted. But in other parts of the world, the virus is really circulating. And so when you adjust the measures, and I agree, and we've talked a lot about this, Alex, with regards to this so-called lockdown. It means lots of different things. But the adjustment of that depends on the virus circulating. It depends on the capacities to respond. It depends on, the well-being of individuals and the context in which they live. All of that needs to be taken into consideration. And don't forget, we also need to have an informed, an engaged, and an empowered community. And children have a role to play here as well. I am amazed by the resilience of children, by the role that children play in this response in terms of, doing these individual level measures and teaching children how to wash their hands or use an alcohol-based gel. And again, there isn't running water in all parts of the world. So we are working towards fixing these types of inequities that exist around the world. Making sure there's access to hand gel, masks, and the appropriate use of masks for different age groups. And that if a child or a young or an adolescent is wearing a mask, that they have clean hands and they put that mask on appropriately. They take that mask off appropriately so that they don't inadvertently inoculate themselves by touching their eyes with contaminated hands, for example. So it's about teaching and learning and behaviors that are growing. But I am really amazed, my own kids, in terms of what they are learning and how they sneeze into their elbow. Maybe after the sneeze comes out, but at least there's a behavior that's happening with that. And how young people, children included, are showing that they're part of this response wherever they are, in being kind to others and helping others out. And I have my rainbow behind me here that my son drew, and that I know Jérôme has a copy of as well. I don't think Anshu has one yet. I'll have to get him one. But Alex, I know you have one too. But kids are part of the response. Kids are part of the solution. We need to make sure that in this response, we don't blame children. and young people and adolescents, but that children and young people are part of this response because they're part of the solution.
Thank you so much, Maria. And we are receiving a lot of good questions, and I know we are running out of time, so I'll try to pass them quickly on you. And the first one is that a few of our viewers are saying that they notice that the children are developing addiction to gadgets and spending more time in front of TV and phones. So what do we think about this, and what is the recommendation we have? And there is sorry, a second question again about the sedentary behaviors, is that children are having less physical activity, and especially that it's problematic for children who are already overweight. So what is our advice on these two issues?
Thanks. And I think the two are related, because children are spending more time either on the internet or on their phone, they actually have less physical activity. And but what is very important indeed is maybe to have, rules with children and to develop them together as parents and the child, and to agree on certain times during the day where they will not have, let's say, where there's no screen time and they do something else, they play. That it's important for them to also understand, for example, when they would be at risk online. So to identify danger signs by the parent. So, for example, if the child is maybe becoming secretive or withdrawn, it might be because something has happened online, and the parent needs to be able to pick that up and to look into that. The other thing also that's important is to explain to the child what potentially would be inappropriate, and also potentially for parents to use parental controls on what they can access, etc. But it's indeed an issue because children have been in lockdown, but they couldn't go out, and therefore the alternative to going out and playing with friends has been to be on the internet. And hopefully, we will be able to make sure that by supporting parents and children, they adjust sort of their daily rhythm and incorporate other elements in their daily routine so that reduces.
Thank you so much, Anshu. Jérôme, Maria, would you like to add something?
As we're getting closer to the end, I will just complement on what you say. Also, this is a serious issue that is growing. It was already an issue that was of concern before the pandemic, and that's pandemic and has played a role of accelerator. I think we don't know everything yet about the impact. I want to emphasize on the fact that there are some existing resources that were worked on and that are available online, including on cyberbullying and on the question of access to digital for children, and that we can share as a resources. I also want to say that on all these questions you ask, there are some tips and resources that are parental tips, parental guidance, parental discussion, Q&A that are made available and were developed jointly with WHO and other partners that you can consult. One thing I want to say is true for this, it's true for everything actually, is it's very important. We're talking about children, but I think it's key to talk to them and ask questions to them. When we talk about children, the most important is to listen to them. They have something to say, as Maria said, and actually they have the right to participate in any decision that is of their concerns, and that's guaranteed by the Convention of the Right of the Child. So this is very important. I want to just highlight this. On parenting, one of the first steps is to listen and to their kids. Over.
Thank you so much, Jérôme. And Maria, please go ahead.
No, I mean, just to re-emphasize, things that have already been said, we do need to listen to children, and we need to learn from children as well. I do really fully support the idea of a daily routine. We know that helps with kids. The situation has changed drastically since the beginning of the pandemic. A lot of kids in the beginning were really stuck at home and indoors. And that has slightly changed, but you can even do some exercises inside. Some of it doesn't actually take you away from a screen, because there's a lot of really good videos and yoga and sort of calming and breathing and relaxation measures. There's some fun activity classes for kids that you could do online. So that doesn't actually address the screen time, but it does address some of the physical activity that can happen at home. But I think every day, all of us, including children, we need to find some joy in every day. This is a very, very challenging situation. 18 months in, we are exhausted. We are ready for this to be over. But we have to find some joy in every day. One of the positive things that we have seen in this pandemic, if you can call it that, is in some parts of the world and in all countries, we've seen families being able to spend more time together and find ways to, in some cases, reconnect. And so there is a little bit there that I find some silver lining in. We've certainly seen it in my family as well. But we can get outdoors. And so every day, if you are able to get outdoors, follow your local restrictions on what is being told to you to keep you safe. But if you can get some sunshine, if you can get outdoors and some fresh air, and if it's safe to do so with your family, I encourage outdoor activities to do that. And also, we have also seen a positive impact on fathers in this pandemic, and fathers being able to spend time with their children as well as mothers. I mean, the burden has been on women in this pandemic, but we have seen some connections with fathers and their kids as well, and that is a positive benefit. So daily activity, try to limit your time on screens, but recognize that we're all doing our best. Give yourself a break, but find some joy every single day.
Thank you, Maria. I will take maybe one or two more questions because there are more coming in. One is coming from our viewer in India, saying that students are suffering from an anxiety and they're mentally disturbed due to COVID. What's the solution? So maybe we can give apologies, advice to parents and teachers how to support students.
I mean, how much longer do we have, Alex? I mean, that's a huge question in terms of what is the solution. But it's a combination of factors. I mean, Anshu and Jerome, please come in here. But it's a combination of factors, and there is a disruption. There's a massive disruption to children and young adults, and the uncertainty that this pandemic has added to their lives. Many people right now in the Northern Hemisphere, they're graduating from either younger ages up into older, or graduating from high school into and possibly going to university or trade school or the next part of their life. And it's added some uncertainty. I do think, re-emphasizing how we talk with children and how we understand the concerns to see what it is that we can do. But I also think, especially for the older children, to seek their help in the solution, because this is their world after all, and it will be the world that us older folks leave to them, and they need to be part of that solution. But I think we could probably have an entire session on that, and maybe we should, Alex.
Thank you, Maria.
Maybe just to add, of course, many younger adults will be concerned about their future because they've gone to university and either the diplomas are being delayed, or they might have lost a full year of school. In some countries, they might have lost a full year of school. And of course, also the labor market will have adjusted because of the economic downturn. So it might not be as easy for young people who are just coming out of education to actually find employment. And this, of course, will cause mental stress, etc. So it's something that we have to address. I think that's why psychosocial counseling is going to be very important. But at the same time, both for parents and children, is to step back, to deal with their emotions, look at their support groups, and find support where needed.
Thank you so much, Anshu and Jérôme. Any advice for you for how to support adolescents, students, children who are having some mental health issues due to COVID?
I'm not gonna extend further. I think, like Maria said, it's worth probably having a fully dedicated session on this. This is a very terrible trends that we are seeing. It requires a whole of the society response and commitment of everyone. This is key because we're talking about the future generation, as we say, no, we will be judged on our capacity to respond to this pandemic, based on the future and the world we will leave to our children and to the next generation. So this is something I think would be worth exploring further in a dedicated session. Happy to contribute and join again if needed.
Thank you, Jérôme. Thank you, Maria.
Alex, may I say one more thing? I'm sorry because I know we're rounding up. I think that just one thing I want to say is that right now it's okay not to be okay, but we need to reach out and we need to seek help and we need to look out for each other. So as parents, if we look at our children and we need that they need help, it's okay to reach out. And there are services that are out there that can help specifically catered towards children. And there is no shame in that. But it's not okay to leave it at not being okay. We need to find the ways in which we can support children, parents to get through this. We will get through this. This is a terrible situation. It's a traumatic situation that all of us are in. We are doing the best that we can to get through this each and every day. But we have to help each other. One of the things that all of us can do to help each other is to be kind. And especially people who are on the internet and children that are on the internet, to be kind to one another and to support one another. Any way that you can, if it's online or if it's offline, and offering support. We are only going to get through this together.
Thank you, Maria. And maybe for the end, I would read a comment that Andrew Koch has wrote. Practice mindfulness, support each other essentially, be socially responsible, stay healthy, be active. So this is a summary of many of advice you gave today. I would like to thank all our viewers watching us from all over the world. I will list some of the countries like Austria, US, Nigeria, Canada, Rwanda, Italy, Iran, Burkina Faso, Sri Lanka, Sierra Leone, the Netherlands, Barbados, Ethiopia, Argentina, France, Brazil, Canada, and many more. Thank you to all of you for watching us today. Thank you for following our advice, for leaving your questions, and special thanks to Jérôme, to our special guest today, and Anshu, and of course to you, Maria. Well noted on potentially having a special session dedicated to mental health of students and adolescents. We recently did some overall mental health session with the Devorah Castellar, Director for Mental Health, but maybe we can have a special focus on children and younger populations jointly with UNICEF. Thank you so much. I would just use the chance, Jérôme mentioned on the product that we worked on jointly with UNICEF and other partners on parenting tips. We will share in comments and in reply on Twitter where you can find all of these tips. So we hope it will be of help to you. Thank you so much and stay safe.
Thank you. Thank you very much.
Thank you.
Thanks, Alex.